Welcome to this special live edition of the eClinicalWorks podcast. I'm Adam Siladi, and joining me today are Dr. Holly Dahlman and Amy Burrell, care manager and nurse practitioner from Green Spring Internal Medicine. Welcome to both of you. Thanks for being here.
Thanks for having us here. It's great. It's an honor to be here.
Absolutely. No, it's a pleasure. The pleasure's all ours. So you actually had given a presentation not too long ago. You're one of our presenters here at the conference. And tell us about what the presentation focused on.
Yeah, so the presentation was on the toolkit that we used, basically different tools within eClinicalWorks that we use to improve hypertension control at our practice. We talked about both population tools and patient encounter tools.
Hypertension control, of course, quality measure that a lot of programs or recognition programs and things like that are focusing on. Why pick that one and not something else like diabetes care or whatever else there might be out there?
Sure. Well, back in 2011, we saw data on the MAC dashboard that indicated that our hypertension control rate was only 1% above the national average. And as hypertension is a leading cause of death in the United States. Also, the outcomes of uncontrolled hypertension are terrible: stroke, heart attack, kidney failure, and other really poor health outcomes. And so we felt like the measurement that we had back in 2011 was reliable because hypertension is an easy data point to capture. So we believed in that measurement, and we knew that we had to improve our practice.
And you've done a lot of work in terms of that stuff. So back then, what was the rate then, and what is your rate now?
Sure. So back in 2011, when we measured hypertension control, it was only 47.7%. And now, over the past few years, we've been around 80%.
I mean, that is a very large change there in terms of your performance rating. What types of tools or activities have you been utilizing to make that happen?
Sure. So we like to refer to the 3 R's, which are registries, resources, and reporting. So we basically use the registry within eClinicalWorks to identify our patients who have either not been seen in the past year or who had uncontrolled hypertension at their last visit. We try to get them back through. We bring our patients resources so they can know about their disease and the factors that influence it. And then we also engage our patients in their own blood pressure readings.
And from your presentation that you gave, I learned that it's not all hard technology that you're utilizing. You're also using a lot of soft skills and management for those patients. Maybe Amy has some hand in that.
Yeah. So I'm a nurse practitioner, and I think nurses and nurse practitioners play a great role with physicians and medical assistants in improving population health, particularly hypertension. So part of what I do is I help oversee our medical assistants in running registries and making phone calls and getting our patients who have high blood pressure back in the office, who haven't been seen in a year or two. And sometimes we have patients who, high blood pressure is called a silent killer. Patients aren't aware that it's slowly damaging their organs. It's damaging their kidneys and their heart and their brain. And so part of what I do is I make phone calls and I just reach out to them and engage with them. Ask them, do you understand the consequences of uncontrolled high blood pressure? Do you know what that does to your body? Are you taking any medicine? Why aren't you taking any medicine? What can I do to encourage you to get you back in the office? Do a lot of what's called motivational interviewing, just really trying to engage patients on a one-to-one level and encourage them to come back and see us so we can improve their health outcomes.
Now, the motivational interviewing component you mentioned, I know that from my experience with programs like patient-centered medical home, that's a very central tenet. That's one of the things that they recommend as far as ongoing staff training, to keep your skills fresh and things like that. Have you participated in any of those types of programs?
Yeah, so the patient-centered medical home pilot program that we're a part of in Maryland has offered motivational interviewing training not only for staff, but also for clinicians, because a lot of the times we just need to relearn how to have a conversation with our patients. Really, our patients are going to achieve the goals that they set. So it's really kind of bringing us back to asking open-ended questions and helping to understand what our patients are thinking. You know, if our patient has the priority of addressing their knee pain and we want to address their hypertension, it may be a lost cause. And so, you know, some of that training has been really highly valuable to us. And our ACO that we're a part of is also going to be doing some motivational interviewing training. Maybe you might be able to speak a little bit to that, what Sharice is doing through motivational interviewing.
Yeah, as part of our accountable care organization that we're in, they have been providing staff training for care managers, even for non-nurse care managers and medical assistants and staff to be able to engage patients on blood pressure control, even just simply how to take an accurate blood pressure and how can we teach patients to monitor their blood pressure at home, and when should they report back to us, and how can our, you know, they're helping us train our staff to engage patients as well.
Now, when we're measuring something like blood pressure control, obviously there is the performance rating that everybody's focused on, and you said you got that performance rating from your meaningful use dashboard. But there are also a couple other metrics that you mentioned in terms of your registry usage as well. Maybe you want to share some of those?
I think we can talk to using our registry for other quality and performance improvement initiatives. Like maybe you want to talk about falls prevention and getting, like, finding patients who are at risk for falls.
Yeah, so we have a mini falls prevention program where we've used the registry to identify patients who, you know, they have had an ICD-9 coding for a recent fall, dementia. We used a whole lot of different ICD-9 codes to run a registry to identify patients that we thought were at risk for falling. And of course, as we all know, hip fracture is associated with increased mortality and hospitalization. And so we use that list to recruit patients for chronic care management. We also did a fall survey where we had a medical student call those patients and try to engage them with a survey on how we can prevent them from falling in their home. And then I signed them up again, like I said, for our chronic care management program, which I have about 20 patients in. And I'm in regular contact with them, and we kind of regularly measure how often they're falling. And we've had a lot of real success with some of our patients, even just anecdotal success. Patients who are falling multiple times a year, you know, we've gotten them into physical therapy. We've, you know, signed them up for a home safety evaluation. And we've had several patients who fall maybe once or twice a year now, and their falls are maybe, they have less injuries. So we've had a lot of success with falls. We also use our registries to look at vaccination rates for exhaustive action shingles vaccines, pneumovax, mammograms, colonoscopies. So we use our registries to improve a variety of different population health measures.
Well, it certainly sounds like you're leveraging that ability to look up lists of patients to great effect. And now, for first-time users or for users who aren't as familiar with the registry, you know, there's a lot of settings, a lot of things you can do with it. It might seem kind of overwhelming. What would you suggest that they do in order to better manage their registry?
Sure. I think one of the most important things is to establish a schedule of using the registries and to have a little bit of focus in your practice. What are you trying to improve? And so we set about to improve diabetes and hypertension 4 years ago, and so now we decided to run our registries quarterly and on a time schedule so that we're kind of coming back to those high-risk patients about 4 times a year. We also run registries on immunizations every 3 months, and then the third month in the quarter we'll run like sort of a dealer's choice registry. And in the case of colonoscopy, that's helped us to increase our colonoscopy capture. I would say also just knowing who is in your panel. You have to decide like whether your panel is the patients you've seen in the past 2 years, or should they be the patients you've seen in the past 3 years? Because some of the patients who you haven't seen, maybe you should have seen. So I would maybe suggest a little bit of a longer interval. It can be a lot more calls, but then even calling people, they have the opportunity to say, well, I moved to Arizona, I'm no longer your patient, but that helps us clean up our practice list. What would you say to that, like strategies for new practices?
I think before we answer that one, I think we're going to start passing the mic around.
Oh, sure.
We're just having some internal audio issues here, so I'll pass this down to you.
Okay. Yeah, I mean, we have an online office calendar that everyone has access to, that we have scheduled times of the month to run registries. And I would say running a registry really doesn't take that long. It only takes actually a few minutes. What does take long is our medical assistants who are making the phone calls and, of course, following up on those phone calls. But setting aside specifically maybe 2 hours each month to run registries, think of registries to run, and figure out how we're going to run them and run them. It has really been successful for us, and we do that once a month. And like you said, we're quarterly. So January we'll do hypertension and diabetes. The second month of the year we'll do colonoscopy. The third month of the year we'll do a vaccine. So we sort of rotate, and that helps us stay on schedule.
Now, the word patient engagement has come up several times in our discussion here today. What does patient engagement look like in your office? Because I have a feeling that it looks different than most people might expect.
Well, our team is called the Early Adapters at our office, and everybody in our office is on the team Early Adapters because we just love technology. And so we're trying on multiple fronts to engage our patients. So we have a Facebook page, Greenspring Internal Medicine, and we are Greenspring Med on Pinterest, and I tweet at Greenspring Med. I also tweet myself, although those tend to be my own opinions, even though I own our practice. And more recently, we've really been getting into Hilo, and I'll let Amy talk a little bit more about what we've been doing with Hilo.
Yeah, so once a month we have a weight management focus group that we meet with our patients. It's about 5 to 10 patients each month, and we've been working with a lot of them to adapt activity trackers so that way they can monitor their progress towards their achieving their weight loss goals. And several of our patients have activity trackers. Some of them are starting to download the Hilo app, so we're trying to encourage patients. We've posted a video on how to download the Hilo app on our Facebook page. I sometimes pull out my cell phone and show them the Hilo app on my cell phone, so it's easy to do. This is how you use it. This is my Fitbit. This is how I track my steps on the Hilo app myself. And this is how I'm personally achieving my goals and how I'm working towards my own health fitness goals, whether or not it's different from there. So I just try to role model health behavior for my patients. So Hilo is something we're really, really excited about in our practice, and we're trying to encourage our patients to start uptaking use of the blood pressure cuffs and the glucometers, and we're really, really excited where this is going to go in the future with our practice. I think it's going to be really great to see the health outcomes improved once our patients adapt this technology.
So with all that in mind, you've done a lot of work so far, and I'm sure the work is never done. What are you planning to do next?
Well, we're very much in the performance improvement space and also in the care management space. So we're working with our primary care accountable care organization to help other practices with performance improvement. So I'm co-chair of the performance improvement work group. We're also doing a lot of work around the care management space and collaborating with other practices. And Amy has been a leader in our accountable care organization as far as what the role of a care manager is and how to leverage the role of the care manager in improving health outcomes. I'll let her talk a little bit about that.
Yeah, just as I mentioned earlier, I think nurses in general, either non-nursing and nurse care managers, just have a great opportunity. We just have more time to spend with patients, time for motivational interviewing, time to help patients set goals, to monitor their goals, teaching patients resiliency too. That's something we were talking about earlier today, is teaching patients how, even if you fail from your goals, something like weight management is there's a lot of shame about obesity, and a lot of people have tried to lose weight and they haven't been successful. And so they get really down and depressed about it. And so teaching them coping skills of, hang in there, push through it, be resilient, you can achieve your goals, don't give up, don't throw away your tracker, keep going. So there's all kinds of things that we're doing in the care management space to engage with patients and doing a lot of patient education. And then care management also involves coordinating with specialists as well. That's one thing we haven't talked about and we use in eClinicalWorks as well. But working with nutritionists, other obesity specialists, cardiologists, and making sure, all of the treatment plans, we're all on the same page and that we, have done a medication reconciliation and that we know what medications the patients are on and what the treatment plan is.
And I think we're also going to open up Hilo for appointment booking. So we hadn't been doing that before, but I think we are going to use that tool to allow patients to have more access to our practice. And I think we are probably going to adopt the analytics dashboard. My co-presenter, Scott, talked a lot about the new features on that dashboard, and even just to report out the clinical quality measures that we need to for our PCMH pilot. That's going to be very convenient for that process, which is very hard work every year done other ways. So I'm excited about that, and I think being able to see our data more frequently will really help us to be sure that we identify areas where we're weak or where we've fallen off and need to kind of gather energy and press forward again.
Well, it sounds like you do have your work cut out for you in terms of new implementations and things like that, but you're already doing a great job with all the stuff that you've done so far, and it certainly has paid off. I mean, those numbers really don't lie. Those are good improvements in terms of your blood pressure control rates and other quality measures that you've been working on. So congratulations on all of that. I hope you're having a great time here at the conference. We got another day to go. We're going to be coming back to you tomorrow with some more podcasts as well. We've got a full schedule tomorrow. But for today, we're going to sign off. Dr. Dahlman, thank you so much. Amy, thank you as well. I'll give you a handshake as well. And be sure to check out our other podcasts tomorrow and check out our past episodes on iTunes and on YouTube. Search for the eClinicalWorks podcast and check those out. For the eCW podcast, I'm Adam Siladi. Thanks for joining us.